on the transcription. So good morning, everybody. Welcome to our board meeting today. And I just want to remind everybody that the meeting is being recorded, and also want to take the opportunity to welcome governors who may be observing us today. I know a number have indicated their intention to do that, so welcome to everybody. We've had apologies for absence from Fiona Barr, Director of Corporate Governance, and Gareth Jones, our Chief Digital and Information Officer. And also, I think there are some directors who've got other commitments they need to meet during the meeting, but we'll manage that as we need to. So I think that's all the apologies formally for today. So I think we can make a start with the business of the agenda. Any declarations of interest for items on the agenda? I'll take that as a no. So we'll move on then to the minutes of the previous meeting. So this is paper A. And I'll just pause a moment to check whether colleagues have got any points of accuracy, first of all. Okay, I'll take that as a no. So everyone happy to approve the minutes then? Thank you. I can see some nods around the room, so that's good. Thank you very much. Any matters arising that aren't captured on the action sheet? Okay, so I'll take that as none. And then looking at our action sheet, which is paper B, we have one action outstanding, which is actually not due at the moment until the next Quality and Governance Committee meeting. So I don't think we need to consider that further for now. On paper C, which is our annual forward plan, I just wanted to note the fact that obviously this remains, as of today, still a reduced agenda reflecting the governance arrangements that were in, that we'd agreed and were in place. Obviously, we have a paper today about the announcement regarding the change to the national incident status. So from future board meetings, we'll expect to revert to a fuller board agenda, but just to be recognised really that obviously important things like, whilst we've always valued patient stories and service presentations, because of the limited time we've had to operate under for the board agenda, we've not been able to accommodate those. But we'll be able to do that going forward. So I'm pleased to be able to say that, and we'll obviously come back to that when we look at paper D1. So any comments on the forward plan at all beyond that? No? Okay, well, we'll move on then to the organisational risk register, which is paper D. So Chris, do you want to highlight anything from that?
Yes, thank you, Krishni. Yeah, just the key headlines. We had the joint committee, again, a very good discussion, looking a recommendation to look at the safeguarding risk as a deep dive, which we'll be picking up. And then Jean also did a detailed review of excess demands. We had quite a long discussion about the high scoring risks, where a lot of environmental factors mean it's not changing. And we've taken that into a exec workshop where we've looked at all the risks again and reviewed them and taken that information on board, and also looked at them against the strategic objectives, which is, as you know, the purpose of the risk register, to identify any barriers to achieving them. So we've done that this week, and then Tina and Richard will be drawing that together for that to come back, and we will be looking to then feed that back into the joint committee with the outputs from all of that. We've also focused on the process for escalating risks, and they've got some suggestions and developments there which will be drafted up, and again we'll come back to the board. Then the rest of the ORR, we've identified those risks are moving. Just some highlights: the the experience of staff with protected characteristics. Because of the progress we're making on the WRES and the DES, we've reduced that down. Also medical appraisals because of really good performance on that, and also the excess demand because absences have reduced. So those are the key features that we're reporting back.
Thank you very much, Chris. Any comments or questions from colleagues? Audit.
Thanks, Krishni. Good morning, everybody. Thanks, Chris, for that summary. I totally agree. Really, this is just a commentary to say that the conversations that we had and the discussions in relation to the risk register were really mature, and I really enjoyed them. And I'm really looking forward to what innovative actions we're going to take to deal with the long-standing past, our risk appetite risks, because all institutions, all organisations have these issues, but it's just how we deal with them and how we have those discussions, and they were very positive discussions. Thank you.
Thanks, Judith. That's really helpful. I mean, I do agree that I thought, it's always good to be trying to drive forward our ORR, isn't it, and make it a living, breathing document that actually is working for us. And I think the actions that have been agreed and clearly the discussions took place are a reflection of that. So I welcome that, certainly. Any other comments or questions? Okay, thank you very much. So on that basis, we'll receive the ORR and confirm, I think, that we're satisfied with the changes that have made and note the actions that have been agreed and are being taken forward. So we move on, as I mentioned, to the review of interim governance arrangements, which is paper D1. So back to you on Chris, on that, Chris.
Yeah, so this is, we have had discussions about the governance, as people will be aware of, but on the 19th of May, a letter came out from the CEO of NHSI moving us from level 4 to level 3. Just to remind everybody, in response to the pandemic, the Trust was very proactive in managing its governance, and we rated meetings according to their criticality. We focused them on key areas and reduced the length of the meetings, and then in December again, so we've kept this under review, we've reconfirmed the approach, but now it does seem very timely, given the discussions we're having, the focus we need and the changing levels, that we move away from the interim governance to put a fuller process in place. So the proposal is that our level 1 and 2 committees go back to full agendas and that we remove the time restrictions. We would continue with the virtual meetings, but as time progresses and in light of IPC, we will look at face-to-face meetings. Indeed, we have one meeting in September already on the books for the joint Together Against Racism work, which is planned to be face-to-face. We will look at the level 3, so we do need to reinstitute some of those, but we just need to keep that under something of review. And the choracy will remain the same, so this should give a fuller governance approach in place. So the request is to the board to endorse and support that change.
Thank you, Chris. Any comments or questions on the paper or anything that Chris has said? Okay, I take it that board members will welcome that, because I know we're all kind of keen to start expanding our, not expanding our agendas for the sake of it, but to allow a bit more time to deal with some of the issues, I think, we, and areas that we wanted to explore. So, so important to have that opportunity. So thank you, Chris, and I think we do endorse that. Maria?
Yeah, I was just going to say it's really welcome to hear Chris talking about looking at bringing back some face-to-face interaction as well, because I think when we had our workshop recently, we talked about how we would all like an opportunity as a board. It's good that we'll have it with LPT colleagues, but it would be good to get something planned for us as a board to have a face-to-face in the near future.
Thanks, Maria, and it is something I've discussed with Fiona, and particularly one of our own board development sessions, as because one of the things, well, we'll be coming on to talk about board development later anyway, but one of the things we're keen to do is sort of recognise there are quite a lot of new members of the board, and part of that needs to be about sort of bringing the board back together and recognise that on board more effectively. I think the people who've joined the board over the last few months, over the last 6 months or so. So that's part of the plan, very clearly. Challenges always trying to find facilities, because I think facilities are slightly more limited than they were before, but we've got some ideas on that, so absolutely support that. Okay, so we endorse paper D1. Thank you, Chris. Jean, would you like to come in on, we always have our bullet point and our opportunity for you to operate on, update us on COVID-19 and winter planning. Always sounds strange talking about winter, doesn't it, when it's vaguely some spring-like anyway outside, but we know what that means from an NHS point of view. So Jean, do you want to come in?
Thank you, Krishni. So obviously Chris has shared that we have now stepped down to a level 3 incident. There is currently no changes to the ICC in terms of how it's operating. We've been asked to maintain all of these current systems we have until after the Jubilee bank holiday weekend. So we are continuing to work as was. In terms of the winter planning and the operational pressures, it has been quite a challenging couple of weeks for services across the county. In particular, colleagues in both acutes have seen an increase in patients with no reason to reside. We are working collectively as a system to look to resolve that and do as much work as we can prior to the Jubilee weekend, because it's important that we give them a head start in terms of what it could be potentially be quite a tricky weekend. In terms of winter planning, the work that we're doing continues, particularly around some of the work on Pathway 1, Pathway 2, which is Pathway 1 is the support of people in their own homes, and Pathway 2 is support of people in a rehab facility in order to move them home again. We're also doing quite a lot of work on delirium and dementia and end of life. We've had a number of meetings with NHS England regarding a discharge focus and how we are all working collectively as a system to support that discharge from the acutes. They have gone well. They have highlighted a couple of things that we need to work on, which is mainly capacity and demand. So that's something that we're now taking forward. So overall, Krishni, it's been it's okay, it's manageable. I think it almost feels like it's a bit of the new norm, but we do appreciate that over the next 3 months there's a lot of work to do to ensure that we are ready for winter.
Thank you, Jean. That's really helpful. Any questions or further comments to add to what Jean has reported back on? No? Okay, thank you very much. That's really helpful. Thanks, Jean. So we move on to our strategy section. So we start with our environmental analysis, which is our opportunity really to just share any emerging environmental issues that we need to be mindful of or be aware of. Angela, anything to report?
Just a couple of things, Krishni. Obviously, as we develop as integrated care system, just to share that as integrated care board, we are now meeting in shadow form, and I think importantly, we've had some development time as well, which focused on digital, which I thought was a really encouraging discussion. So important to share that. And then just one other thing, as part of our East Midlands Academic Health Science Network connectivity, as an East Midlands Alliance of Mental Health Trusts, we have connected with them around a lot of safety programmes, which has strengthened our focus on safety. But importantly, we've got an event coming up on the 14th of June where we are doing a conference together to focus on mental health safety with the Academic Health Science Network. So again, just to put that on people's radar. But that's all from me. Thank you.
Thank you very much. Any other colleagues want to mention anything, David? No. Okay, thank you. We move on then to the Chair's report, which is paper E. I'll take the report as read, but I do want to highlight and particularly welcome two new governors. So Richard Amponza as our one of our new staff governors, who'll be taking over from Tracy LaPenna when she leaves the Trust. And also Sharon Wormersley, who is representing the REACH Collaborative, and is in fact Chief Executive of Lowdown, and that's a service supporting children and young people. So, and I'm really pleased about that because our younger service user governor felt that we needed to sort of have greater, ways of representing children and young people on our council of governors, and whilst that wasn't easy to do from a sort of creating more seats for specific younger service user governors, actually having a partner representative who was representing children and young people felt really important to do, so that was good. But we do also need to say goodbye to a few governors who've given us a great service. Tracy LaPenna, Alec McPheedran, Ranjit Singh and Chelsea Rain. We are hoping that when we run elections again in the new year, that a couple of those governors will be able to rejoin us. So we look forward to, I hope, welcoming them back in the not too distant future. I did also want to mention obviously that the board had our ISA 260 meeting to review our annual report and accounts yesterday. And I think we acknowledged yesterday that positive progress had been made on the report and the accounts, a huge amount of work, reflecting the fantastic work that the Trust and all colleagues around the Trust have done over the year. There is clearly some further work we agreed that needed to be done on the accounts, and we agreed that we would delegate that to Richard as our Director of Finance to progress that with some oversight from Saqib as our Audit Committee Chair. So I wanted to report that for the, because clearly we had our ISA 260 meeting yesterday, and importantly the process will conclude, linked to one of my bullet points in my report, with the annual reporting and accounts being presented to our governors and members of the public at our planned meeting of the 12th of September. So just to make sure everyone's got that note in their diary, it's usually a really good event. I know lots of energy and effort is always put behind making that happen. So really just would ask board members to support that. And also just highlight that we do have a joint council of governors and board meeting due to take place on the 23rd of June, and again would really ask for your support in that, because it'll be an important opportunity to explore the sort of areas of common interest together as we're emerging out of this period, this difficult period with COVID. So thank you for that. Any questions? Okay, happy to move on then to the Chief Executive's report, which is paper F. So Angela.
Thanks, Krishni. So obviously Jean's updated on COVID, but I just want to again say thank you to all our staff, because whilst we are in a different level, the pressures remain and the challenges are there, and as ever people are going above and beyond to do and continue to support the population. So thank you to everybody in relation to that. A couple of things just to highlight: obviously the Health and Care Act, the significant sense in terms of that moving now into the integrated care system, which we've obviously talked about as a board, but a real formalisation of that now occurring from July the 1st. And I think just to say, in addition to that, thinking about the integrated care system, I just want to mention a little bit on finance. We've clearly had an expectation in our submissions for our operational plan to deliver as a system. That is clearly the expectation, and we continue to work with system partners on that. Having said that, I think it's really important to cite the board on the fact that there is an expectation of break even across the system, with some inflationary resources and allocations coming towards us. So that presents challenges for all of us, and Richard and the team and myself as others are working very hard to move towards a resubmission on the 20th of June. And that will include, I think, a financial regime with much more now rigour on spending controls, agency and implementation of infection prevention and control measures and consultancy costs. So again, I think we're seeing a change towards the emergence from the COVID financial regime that we had previously. We'll just draw people's attention to the mental health and wellbeing consultation that's going on, and that's really important to share with people if people have a chance to have a look at that. I can see Scott's put his hand up, Krishni, so it may be on one of the items before I carry on.
Scott, did you want to come in?
Well, if you don't mind, Angela, I don't want to interrupt your flow, but it was related to the
Yes.
point you were making a minute or two ago.
Yeah.
So it's two. I had a bit of a technology wobble earlier on, so apologies if Jean's already covered one of the points, but one was about, I'm assuming as we have a change to our national status, there's no change for us in terms of IPC procedures, still mask wearing, all of that, no change to the levels of hand hygiene, etc. Wondered whether there was any visibility of any activity or intention to revaccinate staff at any point throughout the year. And then the final point was just a comment, really, Angela, which is really encouraging to hear what you were talking about the sort of reintroduction of the greater degree of financial rigour. The system financial steering group kind of ended a little abruptly towards the end of last fiscal year, and obviously we have our board and shadow status at the moment, and we have one part of our organisation in shadow status whilst we're trying to make sure that we're landing a quite challenging and stringent financial regimes. So that part was just a comment to say pleased to hear that, and I think that sounds encouraging. But the other elements would be helpful, please, Angela.
Yes, I think Julie's going to come in on the IPC piece, because I think it's opportune, actually, Scott, to just remind people of where we are and where we're going with that. Julie?
So thanks, Scott. I was going to come in anyway. So yes, there was new IPC guidance out. Mask wearing is still in clinical areas. In non-clinical areas, we still wear it, but if you're sitting in an environment where you're 2 meters away from somebody, mask wearing is not required in the trust. But when you're walking around, it is still required. We are expecting more guidance in the next few weeks around that. There are changes to patient testing. Staff are still required to test twice a week lateral flow testing, so that hasn't changed. And what we are putting together is some information for board members, which will probably come out next week in the form of a flash report against what the changes have been in the guidance. And also visiting guidance has opened up to pre-pandemic. However, still visitors are required to wear masks, which obviously we do provide at all our entrances. So, visitors are still required to wear masks on health premises.
Thanks, Julie. Do you want to make a comment on staff vaccinations as well? Because that was one of the other points. Is there any emerging guidance on staff vaccinations for COVID? I think specifically was what Scott was asking about.
I haven't seen anything yet, Jean, formally. Have you? No.
Okay. So we await further advice on that then. Thank you, Julie. Angela, I think we've paused your flow momentarily, but shall I bring Richard in on the finance point? Because I suspect Richard might want to just comment on that. Richard?
Yeah, it was a brief point linked to IPC. We work closely with Julie and her team, and I'm pleased to be able to update the board. We've been able to partially reopen some seating within our cafes, which I think is positive news for staff. And obviously within the financial regime, we're supposed to be recovering all of our pre-pandemic non-NHS income, so things like canteen income that we generated previously. As Angela said, we're going to be working through the guidance and setting out a framework so everybody is clear on how we operate within those new requirements. There's also going to be a requirement for use of some of our existing internal audit days to have a review of financial control measures across the trust. So obviously we'll pick that up through the audit committee, and I dropped Sagib a note just to give him heads up on that.
Great, thanks, Richard. Good, helpful clarity and updates. Back to you, Angela.
Yeah, no, thank you. So other bits that I just wanted to highlight was draw people's attention to the Virtual Wellbeing Festival in July. Again, a really important one where I'm hopeful board members can support across the system, but really important range of activities on offer as ever. And then finally, there's some information in the report around the medical education development that ITI is leading, which I think will give some assurance around some of the strengthening that's happening there. But I just wanted to take the opportunity to say congratulations to Dr. Rima Pal, who is one of our SAS doctors in palliative care, who has now achieved a certificate of eligibility for specialist registration on the Specialist Register for Palliative Care. And I think not only is that great for her, but I think is also recognition of the support she's received through Dr. Lily Reid. And I think it's an example of what ITI is leading in terms of trying to grow and strengthen that support locally and encourage our doctors to obtain those certificates as well. So just would want to share that. And other than that, I'm finished. Thanks, Krishni.
Thank you, Angela. Any other comments or questions? No, we're just well done to ITI and all the medical team for that, those ongoing really positive developments around, you know, progress for our medical colleagues and development opportunities for our medical colleagues. So it's a really important part of our offer, isn't it? As in, you know, and illustrates very well the approach that we're taking to ITI's backdrop, which is grow your medical career at NHFT. So I think that's a really helpful. Thank you. Okay, so we're moving on then to the NHFT annual plan, and just checking whether that's David coming in. Both David's coming in on that, but I'm not sure who's leading, so I'll leave you to tell me.
I'll kick off. Thanks, Krishni. So I'm pleased to present, along with David, an integrated plan for the 2022-23 year, covering DIGBQ and the NHFT annual plan. The annual plan guidance was published in December, you might recall, and we're still working on it, which is part of the work that Richard has updated on in terms of the finance position. But I just want to draw a few things to your attention. One is it's been a true organisation-wide piece of work, this. It reflects our intention to link most of what we do to DIGBQ as part of our strategy, so that people can see a clear golden thread between DIGBQ and the things that we're doing for patients. The second thing is that we used a triumvirate approach by bringing experts in workforce together with finance, together with our transformation and clinical leads, to co-design the output so that it's triangulated, so that when we actually get to the point of looking at the money against the people, against the plan, it's joined up. And we've done a stress test on that through the workforce exec group that Chris leads, and I'm pleased to say the plan does look pretty well triangulated on all three dimensions. It also gives you a sense of what we're doing as an organisation, as a local partner, as a regional partner, and as a national partner. So it covers all dimensions of our work as a trust, so the local collaboratives, regional collaboratives, and indeed our national work through gender and some of our prisons secured services. And I guess then finally, we are expecting a refresh of the long-term plan, probably to happen around about October. So I view this kind of as a work in progress. We will next phase is put a delivery plan against it. That will come back to this board quarterly, and that delivery plan may adjust and change in light of further guidance that we get from the long-term plan. So just once again, really just to commend and thank teams for leaning into this in quite a pressured time, and I think the product looks pretty good.
Thank you, David. Did David Williams want to add anything?
I think all I'll do is take the opportunity to reinforce we'll bring quarterly updates back to board that tell us progress each quarter. We are also tracking it through Transformation Committee and the Strategic Exec Board.
Okay, thank you. Any questions from colleagues? Maria first.
It's not a question, Krishna, it's just to say that we reviewed this in draft at the Performance Committee meeting, and we felt that it was a really good piece of work, and we got assurance in that meeting that the work that had gone on with governors in terms of involving them in the process had been incorporated into the plan. So I just wanted the board to know that we have reviewed it in greater detail there and think it's a really good piece of work. So congratulations to all involved.
Thank you, Maria. That's really helpful. Dave, do you want to come back in?
I just wanted to make one final closing comment. So if there's other comments, maybe they could go ahead of me.
Okay. One question from me, and that was just really picking up on the digital innovation and population health piece. Did that include, I'm just conscious that we obviously had a very engaging workshop with the board not that long ago on Power BI and the desire for the board to sort of see that being taken forward alongside the reporting improvements that we thought would be really helpful to us. And I just wanted to be check that we hadn't lost sight of that as part of this, or it was either built into this or was a separate part of our plans going forward.
I can come back on that, David. Yes is the answer. This is a condensed version of a much larger plan which covers some of that detail, and we're doing quite a lot of work locally as well as a system on some of that. So to reassure you, that is firmly part of the plan.
Great. Thank you. If there are no other comments then or questions, and it's very helpful to know that it's been reviewed through Performance Committee as well. Dave, I'll hand back to you for a closing comment then.
I just really wanted to extend thanks to Amanda Johnston, really, who's held the pen on this and is named in the cover sheet. So it's obviously a challenging piece of work pulling these strands together, as I said, during a really pressured time. So just to put that on the record to her and to the teams involved.
Thank you, Dave. That's really good. And as Maria said as well, I just want to acknowledge the contribution of, there were two opportunities, I think, for governors and particularly to engage with this, and of course members as well. And I know David and Dave had a workshop with our governors as well to make sure that they did contribute to this. So thank you very much to colleagues for that. Thank you. So we look forward to hearing the regular updates, which I think we will be seeing usually quarterly, David, if I'm right, at board. Yeah, okay.
Yes, correct.
Great, thank you. Okay, so we move on then to the quality section of our agenda today. And we start with our assurance report from the Quality and Safety Committee, which is formally now the Quality and Safety Committee. So it's over to Julia. Julia, anything you want to highlight?
Thanks, Krishni. Morning, everybody. So just take the report as read, but there are a couple of things we just wanted to add. One was that thanks, Chris, for the update around revised governance arrangements. We absolutely welcome that from the Quality and Safety Committee. We do need more time to really, dive into some of the areas that come up through the committee. So that's really welcome. That's great. And the other thing, just to add from what you just said, Krishni, about focus on digital and innovation. So we had some very, very useful discussions throughout the committee, which we then took forward the following week into our workshop. So we're going to we looked at lots of elements of our effectiveness, but also we want to refocus some of our viewpoints around digital innovation, population focus, health inequalities. We've had all that conversation, so that links up very nicely, and I think we'll be taking that forward throughout the next year, so really, really useful. You'll see there's 3 amber areas, safeguarding as previously, and you've already heard Chris say that we'll have a focus on the 4 safeguarding risks at the joint committee with Performance Committee next time. Workforce due to the continued pressures that Jean's alluded to. I think that's all laid out there. And then lastly, the quality forum. There were a number of areas that we weren't fully assured from receiving reports from the quality forum, and so we've sought some further assurance. But we had a really useful discussion about how we rate the information that comes through from each of our committees, and that's been great because I know that the corporate team are going to take that forward to look at getting some consistency across how we rate all the information that we receive. So that was really, really good. And then you'll note the number of greens, as always, but particularly Freedom to Speak Up report came through, and the others. So really useful committee. Great to change it to quality and safety. I think it reminds us of the focus of the group. So really useful session, and we've got lots of improvements we're going to make going forward. If anybody's got any questions.
Thank you, Julia. That's really helpful. Has anyone got any comments or questions? Okay, so we're just asked to consider the report and obviously take assurance from the work of the committee, which is what it's there to do, and good to see the actions that you've agreed to take forward, Julia, so thank you very much. We move on then to the quality account, which is paper I, and we hand over to Julie for that. Julie?
Thank you, Chair. This is a draft version of the quality account. As you know, the guidance has changed. It no longer runs aside the annual accounts. So this is very much a draft. It's still going through its data and quality checks. There are some gaps in as you see, and it was also presented to the last Quality and Safety Committee. But I bring it here to say that we're still waiting for stakeholder feedback. We have to give a required amount of time. We've had feedback from Health Watch that's already come in, and that was positive. So I'm here to ask the board to delegate final sign-off to the Quality and Safety Committee in June, please.
Thank you. So any comments or questions before we do that, Julia?
Thanks, Chrissy. Just a comment. I know the work that goes into this, so 2 sides of it. One is what a brilliant place to see all of the work and the improvements and the focus on quality for the last year. That's incredible. But also the work that goes on, similar to the annual plan. It's always the work behind the scenes that goes into these things. Very easy to read, but absolutely packed full of all the really interesting and impactful quality improvements that have been happening across the trust. So thank you, and absolutely, as Quality and Safety Committee, we've seen it, we've had opportunity to input and comment, so that great assurance. Thanks.
Thank you, Julia. Yeah, so I would absolutely endorse what Julia said. It's really good, as ever, these documents, to try and capture the kind of flavour of, I think, who we are and what we do, and it's really always great to see that. So obviously we're asked to note that it's still in draft, but it's been through a review already from the Quality and Safety Committee, and we are asked to delegate responsibility for the sign-off of that to the Quality and Safety Committee, which I think will presumably take place by the end of June. So if everyone's happy to do that, I have to take from the nods that they are, so you've got that agreement. Thank you.
Thank you.
Okay, Julie, we move on then to it's actually the Patient Safety and Learning Assurance Report, and I think this one's the lead on this is Linda. No, not Linda.
This one's me still.
Oh, that's okay.
Sorry. So I'm going to take the paper as read. And just want to say, in our last paper, we alluded to the fact that there was a self-harm review of CAMS in process. There was a bit of a confusion between the two thematic reviews. There was another thematic review that was actually in process at the time, which is detailed in the report. So I just want to apologise for the confusion that's been caused, and it is detailed in the report. The self-harm data review has now taken place, and it is also detailed in the report. So I just wanted to apologise. So really open to questions.
Thank you, Julie. I think the self-harm priority or indicator was actually selected by our governors as well, wasn't it? So at an appropriate point, we will need to consider how we report back on that. But I think, is there also an audit taking place around that?
Yes, there is.
Yeah.
So that's related to the quality account.
Yeah.
So you're right. In the quality account last year, there was an indicator, and that piece of work is being undertaken by our internal auditors. It's not a requirement of the quality account anymore to do that, but we see it as best practice. So we this year and last year to go to our governors and ask them to select an indicator, and that will be reported as part of the quality account.
Great, thank you, Julie. So any other comments or questions? I did have one myself, just on the electronic prescribing and medicines administration point about the business case. I was just trying to make sure I understood, and I remember the business case being presented a while ago now, but so it just made a reference to the original business case and what impact or not it might have on the medication incidents. And I was trying to, it might be a bit of a point of detail, but I think it's just the broader point about, if we've said it's going to have a particular impact on medication incidents, are we formally at some point going to review that? Because I think it's really important that if we make a business case, that we check that we're realising the benefits that we expected. So it's that broader point, really.
I think Julie's going to come in on that, but I think she's going to say exactly the same thing as I would have done. Go on.
Thanks, Julie. Yes, just to say, we did discuss this at Quality and Safety Committee, and we have asked for exactly that to come back. So yeah,
great. Good, thank you, Julia. That's what I like to hear. Itai.
Yeah, I just wanted to mention that as part of our EPMA project board, which I chair, we do have a benefits realization log that we look at. There's some things which, before we have rolled out the EPMA program across different parts of the organization, we might not be able to see at this point. But certainly, I think that that comment is noted and will be taken forward.
Thank you, Itai. That's also very helpful assurance. So any other questions or comments relating to this particular report? So we don't need to, oh, sorry, Maria, do come in.
Yeah, sorry for being a bit late. It was a comment a bit about the structure of the report, maybe for going forwards. And I know we've got the SPC charts at the back, but I was wondering if maybe they could be brought closer to the text, just to help our understanding when we're reading the text. And I was in particular the pressure ulcer section, which was really interesting in terms of the factors that you were describing in there, Julie, that might have related to increases, etc., in terms of operational pressures. I was just wondering if we're referring to things like that in future, is it possible to give a bit of data around the pressure, the level of demand in that service at the time when we're seeing the increase in pressure ulcers? And I thought it was interesting when you brought in the Millbrook aspect as well. So it was good to get like that whole system view of what might be contributing to this in the community. So sorry, a bit of a rambling point, but I suppose it's the paper just made me think about the whole system and want us to think about and to have a bit more information about that. Maybe that's something for quality and safety to have. I don't know, but just thoughts for the future. But thank you. I've really appreciated the openness of this paper.
Thanks, Maria. Julie, do you want to come back on that?
Yeah. please. Just to say that we are looking at the reporting of patient safety and how we do that through quality and safety. So we're doing a review, which you would expect us to do every so often. So we will review this paper. We're reviewing and reporting through quality and safety committee as well. We also will review the structure of this report going forward as well. So that is really helpful, thank you, because in the past we put everything into the appendix because that was the request, but actually I can see the value of putting them together. So actually we will review this paper. It's something on the plan anyway. At the end of every calendar year I like to review papers, and obviously this is the end of it, so yeah, so brilliant, thank you.
I mean, I guess ultimately, you know, that there is a very specific way, as reflected in a later paper on the integrated performance dashboard, that the way in which SPC charts are sort of presented. And I think in that making data count session, there was a little bit of guidance, wasn't there, about how we connect the visual presentation with the commentary. So all of that is learning that we need to sort of try and build into our reporting, I think. But there's a lot of, you know, really helpful insight from this report, which I think is really useful in terms of assurance and understanding. So thank you. No other comments on the report. So we're just really, you know, it's obviously there for our assurance around our management of patient safety in this particular context in relation to these incidents, etc. So thank you for that, and I think the board is assured. We move on to the monitoring workforce safeguards paper, I believe now is paper K. I think this might be Linda. Is that right?
That's right. Thank you, Chair.
Good. It's my list is slightly misaligned, so the lines don't line up. So I've had to draw lines to make sure I've got the right person this time. So over to you, Linda.
Thank you very much. With regards to this report, I'll take that the report has been read. And as Julia has just mentioned, in the Quality and Safety Committee, our report was rated amber because workforce continues to be a challenge. And whilst we've got some mitigations in place with regards to our staffing, it was also noted that the increase in bank and agency usage meant that this continued to be an area of concern. A new risk that was highlighted is around supporting children and young people. Not only are we looking at them being supported on our inpatient wards and the community, but also that they were being supported in an acute setting. This is a risk that the collaborative is cited on, and there's been quite a lot of discussion around that, including issues to do with the bed capacity. Other highlights within the report are around our use of bank and agency staff, particularly around use of agency staff and going off framework. This remains a concern with looking at plans on how this can be reduced going forward. We also noted that there was a reduction on unfilled shifts. So these are the shifts that are requested to the bank team, and they will go out to the bank staff. If they can't fill them with the bank staff, they'll go to our approved agencies. Can't fill them with those, then go to our off-framework agencies. And we've had situations where those agencies could not pick up those shifts as well. But huge thank you and acknowledgement to our services, because a lot of the time they do then rely on their skill mix. They'll also have senior colleagues like the ward matrons working within the numbers just to support in delivering our services. With regards to safer staffing incidents, we had 15 incidents noted at the end of March, and of these incidents that were noted, they were reviewed with no harm to patients and all lapses in care. We also looked at the incidents were discussed in great detail within our Workforce Safeguards Board meeting, and we noted that there has been reduction in incidents in some of the settings. We also, within the report, wanted to just highlight the slight decrease in sickness absence as well as the vacancies. There's a slight improvement there. And at the end of March, our supervision record overall, the percentage was 88%. We did note, particularly within some of our corporate teams, that there was an issue around the reporting of it. So whilst it had taken place, colleagues had not yet updated ESR. So we're hopeful that with more people having reported and logged it, then that increases our compliance. With regards to medical staffing, there are plans in place to reduce on locum agency usage, and some positive news being the successful appointment of the clinical director for secure services. I'm happy to take any comments, questions, as well as the last part, which is asking the board to note the risks that we've presented within this paper. Thank you.
Thank you, Linda. Any questions or comments? Melanie?
Yeah, just a comment really. I've been fortunate enough to accompany TI on a number of service visits as the world has reopened slightly and under the strict kind of risk assessment approach that we're taking, but it's been really good. And it just so happens that in both of those service visits, the staff talked very openly about the challenges of not having the right resource necessarily to the level that they needed. But what I took a great deal of assurance from, and it comes through in this paper in the detail, is the lengths that people were going to find mitigations, not always just in terms of locums and agency, but trying to just reorganize rotas to try and get access to alternative resource, to upskill people, to provide a partial element of maybe this psychology or psychiatry resource that they were looking for. So it's just, whilst I know it must be frustrating for the staff and a really challenging situation, there is a great deal of innovation taking place at the front line to compensate when the specific resource required isn't there. And that was really evident in the 2 service visits that I took. So I just thought it might be useful to make that point.
Really useful. Thank you, Melanie. Maria?
Yeah, thanks, Krishni. And that's good to hear, Melanie, in terms of the innovation at the front line, because when this report is really helpful, it's very transparent in terms of the information that we receive as board members and being able to see what the challenges are. But it's also makes you appreciate the stress that the frontline staff and workforce colleagues must be under to continue to try and address these staffing shortages over such a long period of time. Like if you look in Appendix 2, how long some of these issues have been running and people have been managing them. So I suppose I just want to acknowledge the challenge that people have been under for such a long period of time, and ask the exec team around the capacity we've got to keep working at that level of intensity on the front line and in the HR team who must be supporting all this work. Also in the context of the 125, I think it is, new roles that we'll be recruiting to, just to get some assurance around have we got the capacity we need to recruit those new roles and to continue to address the bank and agency challenges and staff shortages.
Thanks, Maria. Chris, do you want to come in on that?
Yeah, I think we've rehearsed in depth the challenge of the workforce. I think we probably have to look back at the track record we've got. So I don't want to underplay it in any way, but you know, the sort of the numbers that we've got planned to recruit, we did achieve last year. Obviously, the pool is more challenging, but I think that we do have that capacity, and if we do identify we need more, then we can prioritise that. I think the bank and agency shift will be more challenging, particularly as now for the finance, they've gone for the no-off framework, and we've got meetings about how we'll look at that, but that literally has just emerged, so that may make it more challenging. I think so. We have got the systems and the track record to deliver it, but I think it's not something where we can say, you know, that's something that we can be confident we won't meet challenges. You know, the level of the challenge is that great, but I think the track record is that we've achieved it and the team are continuing to work to deliver that. And you know, there's a lot of innovation around our recruitment and what we do. And I mean, in terms of benchmarking, we said before, you know, in comparison to others, we are seeming to achieve more. So can't take our eye off it, but at the moment, I think we will continue to feel we will achieve.
Thank you, Chris. I think David wanted to come in. Yeah.
Yeah, so I was just going to add, so I think there's the recruitment we're doing, and Chris has gone through that kind of how it compares to the historic stuff, but also wanted to say across the East Midlands, and one of the things around the Alliance is putting in an additional workforce role that's specifically focused around CAMS. And we've met with Chris and all of the HR directors from across the East Midlands about how we can do stuff once, how we can come up with some new and innovative roles. And actually, I think if we tackle that for CAMS, there's a model that we can then roll out across the East Midlands. And the whole point around that is it should help us stop the kind of the roundabout of staff moving between organisations, and actually an agreement about how we can all do some stuff together to develop talent, which hopefully over time will then grow the East Midlands as a really good place to work. So I think there's the innovative stuff Chris is talking about in NHFT, and then there's also stuff that NHFT is doing with other partners to build and take forward.
Thank you, David. We've started the ball rolling with a number of comments. So Jean and then Julie. Jean?
Yeah, I think it would be remiss of us as a board not to recognise the pressure that there is on the frontline staff, both in bank, HR, and actually managers of services trying to get the staff that they need in order to deliver the safe service, because it is under pressure. I think one of the things that we're really clear that we need to do, and we have starting to put processes in place which needs to be agreed this afternoon, is having an in-depth focus on services. So perhaps 2 services every other week in terms of where they are with the recruitment, their agency spend, what it is that we can wrap around and support them from a corporate perspective to enable them to not feel that pressure, Maria, continuously. So I think there is a lot still for us to do, but we'll continue to work through that to support those teams.
Thanks, Jean. Julie?
So I just wanted to add to what David was saying, that the directors of nursing and chief nurses across the region are also coming together to look at CAMS, new ways of working, new roles. And I agree with David, it's a start of a new way of working, hopefully across the East Midlands. And also to add in that, you know, we're looking at new ways of attracting staff. So we've got a volunteer to careers programme. You know, we've got to look differently, haven't we, at the workforce, and we've got lots of new ways of doing it, and that will continue. I just wanted to bring those to the table, really.
Thank you, Julie. I think my only final comment on this would be, you know, notwithstanding all the innovation that's going on, I think it's important as well in terms of existing staff and existing roles that we really give focus on attention to retention, because there is a cost to recruiting, and actually, you know, the danger is that actually it's sort of painting the fourth bridge on some roles where we recruit and then, you know, people move on, and it's and I know to some extent, you know, there is a kind of natural turnover as well, but I think I know we would all recognise this, but the retention part of this needs to be really, you know, it's obviously really important, and for all those reasons, things like well-being and all the other things that I know we're striving to address, and we've got the people plan on the agenda, will remain really significant, because it's the joined up approach to this that I think will deliver the best results. Richard?
Yeah, no, I'm glad you mentioned that, Krishni. I mean, just to update the board, I mean, we're working very closely with HR colleagues, staff side and others around the inflationary pressures that there are on all of us at the moment, including our staff, and how we can support and signpost people. Obviously, pay is set nationally and we're waiting for that to be determined, but what other support that we can provide or signposting or advice that we can provide, including looking at best practice guidance around all of those areas. So there are regular meetings currently, as I say, with staff side and others to see what we can promote, and there's regular bulletins going out to staff on those matters.
Thank you, Richard. Okay, well, I think that you know, we've had a pretty extensive discussion, understandably, as I think, you know, as the report recognises, Linda, and others who've contributed to it, this is a key risk for us. So it's right that we keep a focus on it as a board. Clearly, there is a lot of you know, a lot of processes around this and a lot of activity to try and ensure that we continue to you know, ensure that we've got sufficient and, you know, appropriately skilled workforce doing the work that we need to. And thank you to, I think, you know, recognising all that work. Thank you to everybody who's involved in that. And obviously, we you know, the board would want to support all that activity in addressing this key risk. So, Linda, is there anything else you wanted to finally add, or are you happy that we've concluded that?
I'm happy that it's been concluded, Chair. Thank you.
Thank you. Okay, we move on then to the complaints report. So we've got two reports. We've got Q4, which is obviously the last quarter of last year, and then we've got the annual report summarising the whole year. So, Julie, do you want to just sort of cover both of them in one, and then we will take any questions together?
Yes, Chair, thank you. Yeah, I'd like to cover them both together. First of all, I think I want to say thank you to the complaints team for the last year. I mean, like most teams, it has been a challenging time for them. And we've seen an increasing complexity of complaints, not just around the numbers, but complexity is very difficult to evidence. You can't evidence that in numbers so much, but I wanted to bring that to the table. You know, we have been delivering to 25 days plus extensions, a very high percentage, even though we've got an agreement for 45 days, which does give us time with the more complex ones or where we've got challenges around investigations. And as we know, we agreed at, I think it was January or March's board, that we would review that and hopefully return to 25 days, and that's always with agreed extensions in Q2, and that will be subject to potentially an increased capacity to the team. The team have been working with increased capacity via bank and a fixed term post during COVID, and that's partly due to maternity leave, but partly due to workload. So we will update in Q2 report on that. We are returning, as per the governance, returns to start up the complaints review committee, and that's proposed for July, but we want to do a complete review of it because we haven't run it for such a long time now, or while we've been in level 4. We want to review the structure, the function and how it works, so that's what we will be doing in July. So open to questions. Thank you, Chair.
Thank you, Julie. So any questions on both, Julie? I'm taking it. Yeah,
yes,
on both reports. Yeah. Julia?
Thanks, Krishni. So it's excuse me, not a question, but just a comment, just to say that I was going to ask about the complaints team and the pressure they were under, because obviously they're members of staff and they're essential to being able to resolve complaints and actually give feedback and sort things out for our service users and patients. But I think you've answered that. You're looking at the team, and it sounds as though you've got some plans in place for resourcing. But again, just to acknowledge the learning that's coming out through this, really important for me that it's shared. And I know we're looking at the lessons learned exchange restarting, but actually you've had processes in place, I understand, to share the learning with staff from these as part of the patient feedback sort of mechanism. So just a comment to say thank you to the team for their continued striving to reach 25 days. Nobody wants a complaint to go on for 45 days if possible, but absolutely understand that resourcing has been difficult and you've got some plans in place to help that going forward.
Thank you, Julia. Any other comments? Melanie?
Yeah, we can resolve this through Quality and Safety Committee, which obviously sees these reports. But I thought it's just really important to maintain that sense of relativity, and within the body of the report, the commentary that complaints and concerns are less than 1% of activity if you take activity as a face-to-face contact. And I actually think that point could be brought out a little bit more in some of the care pathway data, because we see the care pathway in mental health and prison services tend to be quite high, but as a percentage of contacts, it might look a little bit different. And I think it's important that we maybe look to understand that relativity in a bit more detail than our current metrics do. So Julia and I, maybe we can pick that up through Q&S at the next report time.
I think that's really helpful, Melanie. I think that was a reflection for me as well, that it's always sort of actually, it showed, I think one of the annual reports showed an increase in complaints, but is that relative to a proportionate increase in contacts? And it's that sort of thing I think is helpful to understand. So I think that's helpful if you could pick that up as part of quality and safety, and indeed when the complaints review committee restarts. Angela.
Yeah, just to say, I mean, I agree with what Maria's saying in the chat, that the focus on inequalities, I think, will be increasingly valuable to us. So really would commend that. And I think the SPC charts, the fact that those are now starting to be incorporated, as a board, obviously we're saying how important that is. It's really good to see them here. I think it does help. So more of that, please. And as I say, I know that we've had a new complaints manager as well, so that's also brought in new experience for us, and I think that's been invaluable. Certainly I've found that the case, so would just say that to the board as well. But thanks, Julie.
Thanks, Angela. One thing I did want to just reflect on, and the numbers are small, so I don't want to focus on it, recognising the lessons from SBC. I don't want to focus on it unduly, but I don't recall having this, in the quarter, I think it's 5, but overall in the year, I think it's over 10 complaints about breach of confidentiality. I don't know whether that's a new development, because it traditionally, I seem to remember most of the complaints tended to be about care or access or communication. So I just wondered whether, without making, a big sort of action around that, Julie, because it might not be proportionate to the effort needed, but just wondered if it could be looked at just to say, is that new? Am I imagining that, or is that a recently emerging type of area of focus? Because we might want to think about what that means in terms of IG training and that sort of thing. You're on mute, Julie.
First person of the day to do that. We can certainly go back and look at that, Chair, and we can report that through. So we will go back and have a look at that.
That's great, thank you. And I also wanted to just pick up that it's really important, I think, in the annual report, that whilst we've acknowledged that the committee wasn't running, this report has been done regularly, and I think the peer yes. Review forum has been running, because I know governors were a little bit concerned that the complaint review committee hadn't been running. So I just wanted to pick up that we've continued to receive this report here. It goes through quality and safety, and indeed the peer review forum, I think, has been running as well. So is that fair? Or since November last year? Anyway.
Yeah, it doesn't go through quality and safety.
Okay, come straight here.
But yeah, it gets a good review here, and we do an annual report, which is a requirement anyway. But we do take our complaints very seriously in the learning from it.
Yeah. So, but I also welcome the fact that it's you're going to review the complaints review committee and obviously recommence that now. So a very important area, very important that we have kept a focus on it throughout the year, and obviously look forward to resolving some of those concerns you had about capacity, etc., and resetting the timeline for complaints subject to that for closing complaints, which is one of the things that's highlighted. Thank you, Julie, for both of those reports, which are obviously very important to us. Okay, the final report then in this section is paper N, which is the Learning from Deaths report. So it's back to you on this, Julie.
Yes, so thank you, Chair. This is obviously the Q4 report, which completes the last financial year reporting. The only thing I'm going to say is going forward, we are now going to report learning from death straight into quality and safety. And then the patient safety report will provide some high level information, as well as Julia's assurance report from quality and safety will come here. So we're slightly changing the reporting structure so we can have a little bit more of a deep dive into this one. But it's also a change around some of the responsibilities, isn't it? You will note in this paper, we've continued to look at demographics and we've tried to put it against the population. But that's the population of Northamptonshire. We just need to be mindful that some of our patients are outside of our county. But we did say we would do it as much as we could, because it's quite difficult to do.
Yeah, thank you, Julie. So I think we note the changes, which I think makes sense because you're now covering learning from deaths through the patient safety committee. So a sort of a more integrated approach, reporting around that would make sense rather than a separate report. So I think that's helpful, and I trust the board is happy to support that. And I thought it was good to note that because the report itself picks up the higher number of infant child deaths which have been reported for January and February, and the action that would naturally be taken in response to that. So because it was something that the data sort of highlighted as obviously concerning, so it was good to have that assurance. Are there any comments, further comments or questions around this particular report, the Learning from Deaths? Judith.
Thank you, Krishni. Actually, it's a comment about not this report, but generally this section, if I may. I had the privilege of attending this patient safety committee earlier this month, and I just wanted to comment that it was really gratifying to see the patient safety strategy specifically addressing psychological safety of staff when reporting issues. Not only does that protect patients, but it also protects staff. So I was just really encouraged to see that, and that really sort of flows up to, our DPQ strategy. So just wanted to report back that to the board because it hasn't yet come out in any of the papers that we've discussed so far.
Thank you, Judith. That's a helpful reflection, I think, to add to our overall view of quality and safety in this section. Okay, so we have completed that. Julie, nothing to add. So happy that we close off our quality section of our agenda, and we move on now to finance and performance. So first of all, we have an assurance report from the Performance Committee. And I think, Maria, I believe you chaired this Performance Committee this time. So anything you particularly wanted to highlight?
Yeah, thanks, Krishni. In terms of the assurance report, you'll see that it really represents the operational challenges that the Trust is facing in terms of demand, workforce challenges, and also the uncertainty around the financial environment for this year that we were discussing at that time in the meeting. So that hence the reds and ambers on our dashboard. In terms of developing reports for the committee, in terms of the integrated performance dashboard, we discussed the development of our SPC chart reporting and bringing the narrative together, etc., with the charts and the learning we'd had from the workshop. And we're also looking forward to some deep dives now into service areas to help us understand more of kind of the demand and operational capacity challenges going forward. So that will be something new for the committee that will help our assurance process. The agency report is scored as a red rag rating because of, the target was extremely challenging and missed, and we've discussed that a number of times at board already, and we also feel that's going to be a really challenging area going into this year, and is a potential area we've talked already in here about looking to continually reduce reliance on bank and agency, but a challenging workforce picture and environment. Going on to the cost improvement plan and the system finance plan, if you sort of take those together, when we met, the picture was still being finalised. I think it probably still is in terms of understanding where we're going to land, and Richard might want to add something to that. So there's an uncertainty in there, but also recognition of a significant challenge for the trust this year in terms of where we can go to for cost efficiencies. The report we had was saying that, our main area of opportunity was in the workforce, and we just talked about how challenging workforce is, bank and agency. So that reflects the RAG rating there. One other item we had at the meeting was a paper on the estate strategy in terms of work we're doing to refresh the estate strategy. And we've requested a timeline for that piece of work, when that will be coming back through the committee for refresh. So happy to take any questions, and that's a summary of the meeting. Thank you.
Thank you, Maria. Saqib?
Yeah, I just wanted to comment on the agency one. So this has been highlighted. Obviously, it's an area that has got a lot of focus, and you highlighted about the point about the retention, the impact it has, both bank staff, the impact on salaries, the impact on cost, motivation of existing staff when people are coming and going, and also when bank are obviously be paying a higher amount. So I think it's an area that we have to really be on top of. And I know I think there's a stretch target, isn't there, Richard, for next year? Was it of $500,000 or $1 million to reduce on that spend? So it is something that's obviously, as we're heading into the inflationary pressures being higher and higher. It's something that it's going to be a real challenge in 22-23.
Thank you, Saqib. Richard, do you want to come in at all on that?
Yeah, we haven't formally had sort of agency targets set to us, but we are expecting those to come. I mean, when we've looked at, I think the paper is setting out, if you compare our pay as a percentage of income, we're spending something like 6% higher on pay than we were on a pre-pandemic basis. So a lot of cost has gone in, and that's consistent with most organisations across the NHS. So hence why, we need to look at activity, productivity, how we're using digital, and how system programs are supporting us. It's clear we can't deliver the level of efficiency required just on an organisational basis. And obviously the ICB is being formed to support organisations become sustainable over the medium term. So that's the work that we're doing. That sounds easy to say, but of course it's all quite complicated to deliver. And we're very conscious, which is why, I'm taking an active role in the group supporting staff with inflationary pressures and well-being, and partly, in part why I was keen to lead the new ways of working piece as well, so that we align the financial challenges we've got with making sure we are supporting staff.
Thanks, Richard. I mean, obviously, we had made enormous progress on our agency target, hadn't we? And met the original thresholds that were set with, if I remember correctly, that were originally set by E&I, but the COVID period has really exacerbated our reliance on that. Just before I bring other colleagues in, and because you've mentioned it, Richard, is there more we can do together around agency and bank, around the system front? I know the roles are different sometimes that we need, but I just wondered whether, whether any discussions are underway around like system bank or system approaches.
Sorry, Krishna. Yes. So Chris and I have spoken about that internally, and the finance directors collectively are talking with the people board, and there was further discussion on that yesterday with chief execs. So yeah, it needs to be a whole system approach in the same manner that we need expert advice around safer staffing from Julie and Linda and her team on what is appropriate, and we need to look at activity that's being delivered and how we're doing that, taking advantage of virtual as well as face-to-face opportunities. There's a whole comprehensive programme that we need to get back into, and obviously in recent times we've been very focused on dealing with the pressures from the pandemic. So yeah, it is quite a shift for people.
Thanks, Richard. Melanie and then Scott.
Well, I think I just want to, unfortunately, I don't have any solutions to offer to the comments that I'm just about to make. But I think this is a really significant issue because we talk about the pandemic being over, but of course recovery and the escalation in demand has meant that the pressure on staff hasn't reduced at all. And I think when you're trying to find efficiency, you normally need to give people the bandwidth to step away from the day job, to look at things through the lens from the outside, or to reach out to other places to get that sort of perspective, and to do a lot of the handover between teams and departments is where a lot of time and inefficiency can be found. So again, you can't just look at it from an insular perspective. You of course have to look at it in terms of the chain of work that you're doing. And I just recognise that the pressure on staff to be able to do that to the level that we maybe need them to do sounds like another immense burden. So I'm just interested in how far you think, turning to, for example, Nhft or to other and working as a system might enable us to access ideas and some of that work without loading yet another kind of immense burden on the staff at a time when I'm not sure they've got the bandwidth to absorb it.
Thanks, Melanie. Richard, I'll bring you in later if that's all right, because I can see that Chris, you and Paul all want to come in. So I suspect between you'll cover off some of the comments and questions. So I thought it might be good to just take Scott's comment first, and then we can make sure executive colleagues have the opportunity to comment back. So Scott.
Yeah, just a couple of quick points. First of all, I'm going to put it in the chat, but to publicly thank Maria for her excellent chairing of the performance committee last time. She's absolutely saved my bacon from a bit of a diary car crash, so thank you to Maria for that. I think just listening to some of the dialogue here as well just sort of prompted something, Krishna. It was actually something that you had said in relation to how well we had historically managed our agency spending controls. I think as we start to slip back more into sort of for former BAU environment, it might be useful to think about from a broader efficiencies management and SIP perspective. Could we sort of look to reintroduce some of the activities that we did before, where we track these sorts of activities at each tier of their maturity? Richard, I'm thinking about the sort of stuff that we were doing a couple of years back when we were sort of talking about all of the various different stages of maturity of SIP activity, and that might help us introduce in a more sensitive fashion how we get the controls back in these areas such that it doesn't feel like something that's inappropriately sort of setting a too stringent environment for our frontline colleagues who are seeking to manage the operational pressures of this, but then at the same time offering hopefully a useful balance to try and sort of take some of the control back in this area as we get back into a more normal environment, whatever that looks like as we go forward. So just some food for thought.
Thanks, Scott. Itai?
Yeah, I just wanted to come in on the point about working with ICS partners around sort of tackling the agency challenge that we all have. One of the things that we have done for junior doctors is to sort of match some of the bank rates that the acute trusts were offering, so that we can actually have a pool of junior doctors who can work for those shifts between acute hospitals for some of our own calls. The challenge we have with some of the more senior roles is that, we have psychiatrists in the main, and they have physicians and surgeons in the main, and we don't, we can't sort of have mutual aid with them around that. And so our efforts are more within the East Midlands Alliance in terms of, how do we get mutual aid? How do we get sort of flexible job plans that allow people to work across different spaces and thus reduce agency spend. So so that's some of the challenges and some of the efforts that are being made to sort of gravitate towards that.
Thank you, Itai. Thanks very much. Okay, so if we've got Chris, Richard and Paul, so if you wouldn't mind between you sort of just picking up, I think, a couple of points that people have raised around things like learning from the success we had previously, for example, and I think Melanie's point more generally about making sure we don't we do it in a managed way. That's what, whilst still recognising the pressures. Chris, then.
Yeah, so we are working closely with system partners through the people board. So, for example, international recruitment is done across the system, and we've had successes with that. And we're looking at recruiting mental health staff, how we can do that. Well, it's quite challenging. Also, within the acute group, as I understand it, they are starting to look at whether they can share their bank, how they can do that, what sort of IT systems can work. If they can progress that, then clearly that might open the way for Nhft to join that. So that is being explored, and we have in the pandemic had the MOU to share stuff, and we are sharing development opportunities and other work. So clearly working across the system and seeing what we can share and learn is already a feature of what we do, and we will build on that.
Thanks, Chris. Richard, and then finally Paul. Richard.
I was going to make a point about group, but I'll probably let Paul make that. So instead, I think, I mean, as the board are familiar, we've approached this very much from a kind of quality perspective. This isn't about financial controls, this is about solving problems. So some of the things that we've been successful with, like reducing mental health out of area placements, is how do we improve the quality for patients, and as a consequence we save money by not placing people a long way from home. And similarly, agency, it's not about controls, it's about, as Chris says, it's about solving the problems of recruitment and retention. And all of it that we've approached has been from that sort of angle. So that's, again, the approach that I would want to take. And we know some of the risk areas and we're very familiar with, so we'll approach it from that direction.
Yeah, thank you, Richard. I think we all recognise that the agency challenges is as much a quality challenge as it is a financial challenge for us, and it's important to remember that there are two sides of the coin. Paul, finally.
Thank you, Krishni. And as Richard's just alluded to, part of what we can do across the group is to do that. Compare and contrast an agency would be an excellent point where we can start to do some further work on that. And the point I was going to make was in relation to what Melanie said around, you know, how do we get to the next level of transformation, given that what we're looking at is what we've been successful at the past. We need to add a layer of things that we haven't been able to do in the recent past, and system certainly gives us an opportunity to do that. So and as Richard's already commented on the approach for this financial year, we need to look sort of almost a couple of years into the future about how we do that. And just very quickly, I think bringing together some of the health inequalities information, some of the public health data, alongside our own cost information to cost out the patient's pathway through their journey through services, not just at Nhft, but their whole interaction with healthcare. And that will allow us to build cases for future transformation, and also about investment into lower level interventions to stop people ending up in crisis as well. So I think knitting that information will allow us to get to sort of the next level of transformation and savings that we need.
Thank you, Paul. Okay, well, I think that's been a really helpful and sort of rich discussion on some of the points that emerged from Maria's report on the performance committee. I did want, just as we're concluding, I think it is helpful to note that with our vacancy rate, or is it vacancy rate, has decreased to 6.89%. Am I right in reading that? And I think I might have read that's the lowest it's been for quite a long time. So I just wanted to acknowledge that, if that's right. I think Chris is nodding. So that is a positive position, and I just wanted to end on that note. So thank you for everyone's efforts on obviously a lot of things that we talked around workforce again. but recognising the efforts that are going in all those areas. And thank you for the assurance and outstanding kind of issues highlighted from the assurance report. We move on now to the integrated performance dashboard, which is paper P. And Dave, is there anything you want to highlight from that?
Just a few things, Krishni, please. One is we've had a technical issue with some of our online training, which is now resolved, which has had an impact on some of our numbers in terms of training, but that's now fixed, and we should begin to see an improvement in that over the coming months. I guess just probably four other things just to flag. One, I guess, whilst the data continues to fluctuate, as you see from month to month, there are underpinning these as part of the planning round for 22-23 recovery plans, some of which include trajectories to get us back on plan, and you can see some of the out of area placement position improving, which is positive to see. I guess in terms of areas of concern, these are both local and regional concerns are around CYP eating disorders and CYP mental health more generally. I'm going to just ask Jean just to comment on the quality review meeting which we had regionally that Jean and Angela attended, where I think this was part of the discussion, just to give some flavour of the conversation that's happening there. So if I could bring Jean in now, that would be helpful, and then I'll finish on some other points and observations.
Over to you, Jean.
Thank you. So just briefly on the children and young people's eating disorders, I think it's an area that has been recognised, well, nationally and regionally as a concern for nearly every single organisation. And what we did as part of that meeting is we requested some support from regional teams. If they know of areas that are doing things really brilliantly, can they share them? I know in Bath and North Somerset are doing a piece of work that, you know, we've reached out to see if we can steer with pride in terms of some of the stuff they're doing. So we'll continue to do that. At the moment, just for the Trust Board's awareness, I don't have a concrete plan to turn this position around. So it is one of our biggest risks from an operational perspective in terms of how we can ensure that our children and young people are being seen in a timely way.
Angela, do you want to come in before I revert back to Dave?
Yeah, just to say that, as I said, this came up in our regional meeting, and Nigel Sturrock, Regional Medical Director, takes the lead in this area, obviously raised this as well, and we had a conversation about this is a challenge obviously beyond us, but nationally, and I think again, I sit on a national group for CEOs representing the Midlands, and again that is also being an area of focus. So it's one that is nationally, we're trying to get the focus on it, the resources that are required, but as Jean said, this is one that I think is challenging indeed in many ways, not least the workforce issues, but the safety and the pressures. So we're doing as much as we can to influence, but it's absolutely right for Jean to say this is one that we still remain very worried about indeed.
Okay, thank you.
Thanks, Angela. Thanks, Krishni. I joined an NHS Confed roundtable on behalf of Angela to talk about the refresh of the long-term plan. It was one of the primary things that people wanted to focus on, and I made the point that we really need to get into thinking and talking about social media as one of the major places that young people exist in currently and get influenced by. So having a strategy around how we do good public mental health with partners who run social media, I think is going to be really important, and we could play a bit of a leading role in that, I think, across the region. So just on CAMHS, to talk a little bit about the prevention agenda, and I think perhaps for future ones of these, I'll have a chat with Anne Rackham, SRO, for the collaborative, and see if we can begin to bring in some of the work that the prevention pillar is doing, because I think that will add some life to some of the work that's happening in the collaborative more generally to try and mitigate some of these pressures using peer support workers and work around families and so on. So we can look at doing that. And then the final point relates to the prevention work more generally in terms of young people. And I think we've got a a plan. David and I are working up a plan around health inequalities, which will begin to feed into this too. So we begin to think about not just the treatment phase of this, which is pressing and difficult and challenging, but also get ahead of some of the prevention health inequality stuff at the back end. Is going to be pretty important to the future ways of doing things. And then the only final point is looking at the epidemiology forecast from both NHS benchmarking and the Centre for Mental Health. It does look like the peak of acuity that we're experiencing in mental health services will continue for some time and probably follow a wave linked to the economic pressures. So there is a question, I guess, for us potentially as a board, certainly as an organisation, to think about what does a flexible bed model look like to be able to manage that acuity so that we can release some of that pressure as it pops up in the system. We've done that with peer review. If you recall, during the major incident, it might be that we need to do more of that in the future.
Thanks, Dave. And you mentioned the inequalities sort of prevention piece, Dave. When do you anticipate that we will see that? I'm sure it's mentioned somewhere, but I couldn't remember where I'd seen it. My apologies.
It's not actually overtly referenced.
Okay.
There is an oblique reference to it. There is a piece of work happening regionally on an inequalities plan, which is being refreshed, which we're feeding into. I would imagine possibly by the end of June, certainly July, we'd have something concrete. It would be going through the system anyway.
Yeah.
So by then, I'd imagine we would have something. I mean, in our metrics, one of the main prevention mechanisms we have is our IPS service, which is the Individualised Placement Support Service, which is about employment support. And you can see that beginning to improve. So it's about finding what are the other measures that illustrate that we're making a difference to people's lives in a way that helps them manage their mental health needs. Beyond IPS, can we bring those to life in this? Even though we might not be responsible for them, they're not part of our responsibility as a board to report on, but they are important for informing the bigger picture about how we're mitigating and managing the pressures that we're seeing.
Yeah, and clearly, you know, with the formation of the Integrated Care Board and our sort of collective responsibility around inequalities and prevention, I think having some focus on that and understanding where we might be making a difference, I think it's going to be important to build confidence in that area, because we need some and we all need to focus on it and as I say, build a positive narrative around what we are doing and what we still need to do. So any visibility on that, I think, would be welcome. Any other comments or questions around the integrated performance dashboard? Well, thank you, Dave. So I think probably just recognising, I'll bring Angela in a moment, but just recognising what Angela and Jean have said about eating disorders. It was just probably, I mean, I know it will reported back through here, but I think any further developments would be, I think, helpful to report back through the dashboard, given the concerns you've expressed, so that the board decided on whatever steps we feel we can take collectively to move that forward. Angela?
Yeah, just for completeness, just to say, in terms of the system oversight framework and our segmentation as one, which is obviously the top segment, just to say that if people look on the website, it still says segment 2. So it's just to highlight that there is that difference. We've had a letter clearly identifying segment 1, and we have notified NHSI of that discrepancy.
Thank you. Thanks, Angela, and thanks, Dave and Jean. We move on then to the assurance section, and first of all, we have paper Q, which is the assurance report from Audit Committee. Saqib, anything you want to highlight from that?
On the basis that we had the ISA 260 meeting yesterday, then obviously members of the board have been updated on current positions. So I guess the only thing that I would call out as we move during 22-23, we will be calling directors to have deep dives and also focus on evolving trends, because I think that's very important as an audit committee. We react to what's happening, not just retrospectively looking, so including our planned agenda for the next 3 years, that we evolve as we move forwards. Some things that we've called out in anti-crime, making sure that staff are supported with opportunities both to flag up any issues they can see as the risk to the organisation potentially increases as people are under financial pressures, but also to support them with other opportunities, so financial management, etc., so they can manage in these times better. In terms of internal audit, obviously we heard from them yesterday, similarly with external audit. And I think the only thing that I would say is obviously Alistair had the committee in a good place that I've taken over in the last few months. So I hope that trend continues over the next coming months. So thank you.
Thanks, Akib. And good to note that the anti-crime service annual report, you know, the finding of a green rating versus amber previously, I think that's positive. So thank you. And yes, in absentia, and we recognise the contribution of our former colleague Alistair, who obviously chaired the committee. Okay, any questions for Saqib on the Audit Committee Assurance Report? Okay, we move on then to the Joint Committee report, and I'm not sure who chaired this one actually, just so I'm, was that you, Julia? No,
it was me,
Scott. Okay,
Yeah.
sorry. I know you're rotating, apologies. So I wasn't sure which one it was this time, Scott.
No, you know, I wasn't able to attend performance, but I was back around for the Joint Committee, so I was able to do that. So yeah, I'll do the cover of this one. So I think to give a little bit more insight into, I actually think, make a comment on behalf of all colleagues that attended the session, that it was a really good session actually, and probably I think this is the third one that we've done in this particular format, and would probably note it as the most effective session that we've had so far. Trying to explain why I think that was. I think that we were aided, I think, by a very articulate line of questioning in the first instance from NED colleagues, led strongly by Audit actually, where we were looking at quite a lot of detail around risks that were sitting outside the risk appetite range. I think the interesting part was that while Audit led that discussion, actually all NED colleagues had pretty much come to the session with the same preparation, and we were all ready to ask questions in that area. That led to quite a detailed discussion, and I should acknowledge that I thought it was responded to very positively and very openly by exec colleagues, as we would always expect, but most notably by ITI, who engaged quite a lot in the discussion, and we actually took quite a lot of learning out of that in terms of, you know, I think some observations as to how the nuances around risks can actually change, you know, over time as the strategic environment around them changes, and risks that start off stated correctly can, after a few months later, actually suddenly look out of step with the strategic environment as a result of changes externally to our own organisation. I think you've heard earlier on from Chris, you know, I think a really positive response from exec colleagues to take the output from this discussion into SEB and seek to reflect upon that in terms of how the risks themselves are described and how they are boundaried. So I think all in all, you know, I think in terms of how we went through the broader risk register itself, I think, yeah, as I said already, probably the most effective review that we've managed out of this joint committee format so far, and I think probably a good endorsement that the format is finding its feet and working quite well for us. If I move it on to the deep dive session, Jean took us through a review of our risk, which describes our access to community adult services. And again, I think a lot of insight, I think we gleaned from that in terms of the challenges that are being managed by the service, how they're responding to that. But I think one of the things that impressed me most, and one of the sort of strongest pieces of understanding that we took away from it was, you know, despite the pressures that the teams are under, how they're continuing to think, how they're continuing to innovate, they go forward and actually learn from the various different parts of the team about differences of approach across the team and how that can actually assist in the way that they approach the delivery of the service. I think that was a lot of assurance actually to be taken from that in terms of just the way that the teams are structured and how they manage their inter-team working for the improvement of not only their own well-being but the way that they deliver the services. And I think there was quite a lot of positives to be taken from that. And you know, I certainly felt a lot more informed and assured as a result of that. And then finally, I think the only other comment I would bring out is that again, in reflection of the level of the risks associated with it, we took a decision through the joint committee that the next round of sort of deep dive activity will focus on a group of risks which all describe safeguarding activities. And I think, you know, Julia in particular was quite articulate about the necessity to do that, but that was well supported across the committee. Yeah, and I think we'll look forward to sort of getting into the detail on that next time out. So that was what I wanted to draw out at this stage, Krishna, but I'm happy to take any questions or follow-up comments.
Thanks, Scott. Any comments or questions for Scott? Okay, I think that was pretty comprehensive, Scott. So captured well, you know, the level and depth of the discussions that took place. So really good to see that committee sort of developing its remit and its focus. So I think it's really good to see that. So thank you. Okay, so obviously that's there for our assurance. And we move on to a number of other reports for that purpose, which is, first of all, it's the highlight report from our joint working group for LPT and NHFT, which is paper S. David, is there anything you wanted to comment on this?
Just to talk through, I mean, everything's marked there with high assurance, but it's worth just reflecting that the conversation we've had today about where our risks are, the things we're working on, are things we're doing as a group as well. So, I mean, the group employment model and ways of working is about retaining talent. And it's about retaining talent within the two organisations, but also thinking about what the opportunity for joint roles and ways of working that actually take skills from one of the organisations, share it with the others. I think the strategic priorities link into how do we get really good levers to be able to get stuff done in both organisations and actually speak with a larger voice. And the financial alignment, we've kind of touched on the financial challenges today, and there's work going on there around costs and ways of working. So I think there's a real connection about, as we go forward, how do we mitigate our risks by using lots of different strategies, the work we're doing in the ICS and in Northamptonshire, but also when we need to, using the levers we've got with mental health, with LPT as a mental health community provider. I'm happy to pick up any questions, but I thought that context might help.
Thanks, David. Any questions or comments from colleagues? Judith?
Thanks, Krishni. David, I was actually, it wasn't about the paper, it was more about the MOU. I was just wondering if, right at the beginning, it says that the MOU is drawn up to support more effective, efficient and economic working. I was just wondering if there would be a regular report on this to the board, or are there any specific targets that we've set ourselves to meet?
So we've agreed we would review the MOU regularly, so that as we go through that and go through the committees, it gets updated, it'll come back. We've also said that actually what we would do is provide a summary coming back about what have we achieved over the whole of the first year. So I think we're lining that up for a July conversation in the committee and then an update into board after that. So I think there's evidence there. There's a little bit that we did interim wise a couple of months back, which just gave a summary of the 8 strategic priorities and said, here's some of the work we're doing. I'll bring that out and whiz that over as a private email to you. But I think the next time we talk in public board, we'll have another update.
Thank you very much. Thanks.
Thanks, Judith. Any other comments or questions? I mean, I think it's useful just building on the conversation we had and Paul and Richard mentioned, you know, the sort of opportunities in terms of how we learn from each other around the way that we approach agency management, for example. That all of those sorts of things are very much a part of the conversation that we've been having at the joint working group. So hopefully you'll see more of that developing as we mature into those arrangements. Thank you very much, David. We move on then to the Ochendon Report. So this is a one-off report, isn't it, Julie, in response to the final Ochendon review. So do you want to comment on the rationale for bringing it here?
Yes.
and then any highlights?
So as you're all aware probably of the Ochendon review, which was into maternity service at Shrewsbury and Telford hospitals. This review is very clear on its findings and its recommendations. We obviously don't provide maternity services in this trust. The review is aimed at maternity services. However, we do have services, our 0 to 19 and our perinatal services, that do within their service provide a service to pregnant women. So they're on the outer perimeters of maternity services, but rightly all NHS organisations have been asked to look at the 4 themes that are in the Ochendon review. So I'll split this my comments into 2. So firstly, through our quality forum, we looked at the recommendations from the report, even though we don't provide maternity services, and that is the attachment to this. So that went through our quality forum, and they were only partially assured because they wanted to have a bit more information on the themes. So actually this report will also go to the quality forum to provide them some assurance on the deep dive we've done into the themes. And as you see, the themes are safe staffing levels, a well-trained workforce, learning from incidents, and listening to families. And I think most of those we've talked about through the board this morning, haven't we? So I think I'd like to bring that to the table first. And what we try to do in this report is provide some assurance that we have structures and processes around these themes that we can assure the board. And I won't have everything in this report because we are doing a lot around these for our assurance from ward to board. But wanted to bring some assurance here of the things that we are doing, and I'm sure others can add to this. But really it was to bring to board assurance that we do look at these 4 themes and they are high on our list of keeping people safe and quality within the organisation. So open to comments.
Okay, thank you, Julie. Any questions or comments? Maria?
Yeah, thanks, Julie. It was a really good report, and the bit I wanted to comment on was the listening to families bit. When we did our effectiveness review of quality and safety, we were recognising in that we wanted to hear more from patient voice and families in that meeting. And I was really interested to see in the report that we have patient and family liaison lead role in the trust that works with families who've raised concerns. And I just wondered whether that might be a role or someone we could invite to quality and safety to talk to us a bit more about their work, so we could hear how that's going and what support they get around that. So it was just that really to inform the board in terms of our quality and safety committee. We want to make sure we're amplifying that voice in our work going forward. And then when I saw that role, I just thought, oh, that might be quite an interesting staff member to bring to our meeting to get a bit of insight.
Yeah, we can certainly do that.
Yeah, I think we established that role a few years ago, didn't we, Julie?
It's got to be about 5 years ago.
Yeah.
It's got to be.
Yeah, because I remember, I think the person who was doing the role at the time used to come to complaints, or one of the committees.
She still does. Same person, still here.
Yeah. So yes, I sort of I think it was for all the reasons Maria said, really important role, because it allows us to really put the energy and effort into making sure that we support families and carers through particularly any processes that are could be difficult for them to experience in terms of making complaints and that sort of thing. Okay, Julia, I think, Julia, did you want to come in, or you?
No, Maria beat me to it. It was all about listening.
Okay.
With people. Thanks. Yeah, she's covered that.
Thank you. Angela.
Yes, just to say, so really welcome the fact that we're looking at this despite not having the maternity services. So just a couple of comments and questions. One is clearly this is really important for the system, Julie, isn't it, in terms of the system quality work. So just get a sense of how it's connecting in there would be useful to hear. And then secondly, when I was chatting to one of our students this week, they talked about preceptorship and the value of preceptorship, which I think is also commented on in the report, and just whether we could do more to promote that within our AHP profession. Because whilst we have it, I think the student feedback was, does everybody realise the benefit of this actually? So I think there's perhaps some stories we can capture, but also some more communication on that to promote it. Thank you.
So in answer to your questions, Angela, I know that Linda is going to be meeting with that person you've spoken to around preceptorship, and we will be doing some work around that. But also to say, as you know, we're looking at an AHP lead post in the trust, which will be able to take that work forward as well. With our AHP lead having left the trust, we're in the process of reviewing the job description and recruiting. So I think that's important to say. And as the report says, we do have somebody who sits on the local maternity committee, which is now chaired by the chief nurse for the CCG. So one of our operational managers sits on that. This Ochendon report hasn't particularly gone anywhere. It's the first time it's come here, but it's something we can share with the system. I know the system is very much looking at the Ochendon review. We do have 2 maternity services in county, one at each of the acutes, and there is a lot of work going on in the background around Ochendon in terms of those, and it does feed into the quality system meetings that I'm involved in. So
thanks, Julie. So it's very much a system responsibility, isn't it, now to make sure that the local maternity and neonatal system is working effectively, and obviously this will need to feed into that. But I think it was important for us to make sure that we took really the opportunity to reflect on the broader learning from the Ochendon report and satisfy ourselves about where we were. And there are a couple of actions, I think, Julie, that are highlighted in the report. So obviously, you know, it'd be good if quality and safety could just make, you know, keep that watching brief on taking those actions forward. So I think it was just about a positive action around professional nurse advocate rollout. I think that was something else as well, wasn't there?
So the plan is
patient safety
for the quality forum to oversee the actions. Linda chairs that, and the assurance will come through the quality forum's report to
the quality and safety committee.
So there's a plan behind this to actually to make sure these actions take place.
That's great. That sounds perfect. Thank you very much, Julie. So really helpful assurance, a couple of actions to take forward, and we're clear about the process for future reporting as well. So and I think if you'll take forward the action around the liaison role, and so everybody sort of understands how that works, that would be good. Right, thank you very much. We move on then to the Freedom to Speak Up annual report. Is this this is from Dave, actually, isn't it? You're taking the lead on this, Dave, is that right?
Well, with your permission, I'll invite Beth to present. It's her work, so thank you.
Okay, thanks, Beth. So let's look at how much time have we got. So yeah, it'd be really good to get, obviously take the report as read, Beth, but highlight any key issues that you want to bring to our attention. Thank you.
I can do that. Looking at time, Krishni, thank you for that. Are there any questions first? Because if there's questions that people have, I can answer those. If not, I can give the brief overview. But generally, it provides some questions.
Yeah, so any comments or questions? Because I think this has gone, or a report of this has obviously gone through quality and safety already, and we've had some assurance around that. So any questions? One comment that I had, Beth, I just wanted to note, well, in fact, I've probably got a couple of things. Just on page 10, I just wanted to highlight that Leicester Partnership, I'm sure Angela would want to pick this up, that I'm pretty sure their well-led rating is no longer inadequate and it is now requires improvement. Is that right? So I just wanted to note that for the record, because I wouldn't want, I'm sure our friends at Leicester wouldn't want that to be represented incorrectly. So that was the first thing. I think, yeah, I didn't have any particular questions at this stage. I think couple of comments really. One was I think it's really good that we've got the mandatory training, because I think that's really positive in terms of ensuring that, you know, this is given the appropriate airtime. The other thing I just wanted to pick up was in the appendix, learning and identified actions. It is at the please stay conversations. Just thought it was important to note that one of our staff governors commented about this not happening as well, actually. So I thought it was really helpful to see that this was something we needed to focus on, because it's clearly not quite as, you know, it's a great initiative. It's just perhaps not as strong as we would like it in terms of it happening everywhere. So that was just something I wanted to highlight, because it was particularly brought up. So Angela, did you want to come in?
Yeah, just to say that also to share with the board that Beth's doing a lot of work regionally as well, which I think will be valuable to us in due course. A lot of development work going on, which I'm sure Beth can comment on, around, you know, detriment, and that's something that is not as clearly defined or understood or able to be categorised sufficiently. So I think that's something just to share, and Beth's done a lot of leadership work in that regional group, which I would want to just commend, actually, because this is a difficult area. So that's really important. And I think also what's clear is that many of the things that come through, whether it's the sort of compassion, we've clearly got some work coming up on compassionate leadership. We had the Michael West, we've got some more work coming up on that. I think that's so significant in this area. Beth and I have the conversations, Dave, Beth and I talking about how people, you know, have less of that ability to be compassionate, and that focus is really important for us, because you see that weaved in some of the comments. But yeah, just wanted to put the regional work that Beth's leading actually on that highlight to the board. Thank you.
Thank you. So Beth, anything you particularly wanted to highlight that we haven't picked up?
I just need to highlight 4 things then. On page 2, there's an error. Do you want me to go through those, or just let Jane know? I'd said that it would go, the strategy and action plan would go in July. It's not July, it would go in August.
Okay.
And on page 5, just a very minor thing that talks through, I've talked about chart 6 and it says chart 5. And the other thing on chart 10, on page 8, with the workforce, there was some percentages that were inaccurate that had come through regards the Director at Adult Mental Health, Children and Corporate. So they've been amended, and I'll provide those to Jane. So just to let you know that there were some amendments. Key issues are that the strategy was aimed to go to quality and safety. The strategy action plan was due to go to quality and safety in April, and we've delayed that, and the purpose for that is working with Pauline and LPT. We've now linked in with both Susan Clenner and Ellie from Northampton General and Kettering General, taking into account the recently published National Guardian Office framework, to make sure that we've got all of those actions, and in addition the case study recommendations, whichever are relevant to us, so that we can have a strategy on a page. I've started to review other people's strategies, but they're long reports, and we like to have the strategies on a page, like the carer strategy and the patient and public involvement strategy, with what the strategy looks like and what the action plans are behind. So just for governance, that we said that it was going to go, and I just want to make you clear that it won't be going until August to quality and safety. The other elements are that we're continuing to hear people speak up. which is positive. They're speaking up within the organisation. There were no reported external concerns shared outside of the organisations for Q3 and Q4, which is positive. We also have the work that we're doing on detriment and disadvantage. So within the report there is perceived disadvantage following speaking up. So we just wanted to reassure you as a board that I continue to work through that regionally and nationally, and also to propose that challenge, which is gratefully received and positively received from people that we provide that challenge to, working through what that might look like, and if there's some further work to do with our colleagues who perceive there to be disadvantage after speaking up. And as Angela has already said, there isn't anyone within the region that has a policy or a process to actually follow what happens when people perceive that and speak up about that. So that will be really positive about encouraging people to speak up when they know what will happen following that. And we're just starting to review the freedom to speak up policy, and hoping to have that once it's gone through our staff side and HR, looking at employment legislation to make sure that we're tight on that governance, that we can hopefully include that within our policy going forward. Started to really look at where our champions are based within the organisation. That was part of the workforce support that they've provided us, knowing where the gaps are. So that will be our work going through 2022-23. The National Staff Survey results, we're above the rates, so that's really, really positive. Taking on board your comments about the freedom to speak up report, which is why I had put in the ratings were correct as of May the 2021 above that, but I'll probably make it clear. So that was just above that, that's where it was. We continue to recruit our champions. And my other big element of work, although out of the 135 concerns we had during this year, there were only 22 forms returned. And although they shared lots of positive stuff with me as a guardian and as an organisation, I'm going to try and look at how we improve that evaluation and monitoring at an earlier stage, just so that we can get people to be open and honest and transparent about how they felt, the guardian, the signposting and how that worked.
Okay, Beth, can you pause there for a moment? David, did you want to come in? We're on mute, Dave.
Sorry, I'll come in at the end. I think Beth's wrapping up. Yeah.
So Beth, we've only got a couple more minutes, unfortunately. Is that okay? So if you can just highlight anything else.
Yeah, just to please let you know, as execs and the board, that the follow-up training has been released and it's on Health Education England. I've undertaken the training, it's really good. So that gives us the opportunity of how we embed, learn and follow up on our staff. So just so that you're aware of that. And also to let you know that the strategy hopefully will be part of a board development workshop that I'm working on, Richard, to get that in as part of our plan. And hopefully, really, just if nothing else, that I hope that the supportive summary gives you a flavour of what we've done and achieved within the freedom to speak up on pages 13 and 14.
Yeah,
and
thank you, Beth.
Continued support.
Thank you, Beth. It's a really comprehensive report. You know, it's really helpful to see and receive that assurance. And I think helpful because I know this area is explored in quite a lot of detail at Quality and Safety as well. And indeed, I fully support the idea that we need to, you know, we'll continue to feature it in part of our board development, which is really important as well. And really good to see our, you know, where we sit on the rating, the index. That's positive, but, you know, as you've rightly highlighted, it's an ongoing, you know, it's something we need to really keep working at to make sure people really understand this. So I think Linda wants to come in because there's a positive comment Linda wanted to make around, you know, people's experience of or knowledge of freedom to speak up. Do you want to comment, Linda?
Yeah, thank you, Chair. I just wanted to say to the board and also to Beth that going around introducing myself to the services the staff that I've spoken to know about the Freedom to Speak Up Guardian, so they do know that it's Beth Brand. They also understand the process and they're able to talk through it. And what I found reassuring is that for those I spoke to, they felt confident with the process and said that if they had any issue, they'd certainly speak up. And then visiting staff as part of our Nurses Day celebration on the 12th, I was at St. Mary's all day. I met with staff from the different wards, including night staff. And again, you know, meeting some of our bank night staff, they absolutely know the process as well. And they were clear if they had an issue that they would feel confident in raising it. So I just thought I would mention that.
Thank you very much, Linda. And it is great feedback, Beth, that you have had. I know you said it was a limited number of responses, but it's very positive feedback. So thank you very much, and thank you for everything you're doing. And absolutely, it is a really important priority for us, and you have the board's full support. Dave, did you want to make a final comment?
Just to echo your thanks and to commend Beth for her work and for the champions' work too. It's a brilliant network to have in place, and so reassuring to hear that people are aware of it. And just finally, just to highlight the well-being component of this. So we've got, you know, a workforce tool that AJ's team has helped us develop, looking at different metrics to gauge where teams are in their well-being. And quite often when we put everything looks okay, but if we put a Freedom to Speak Up filter on, we can see that there are issues that we can help teams address. So it's got a really important role to play in well-being. So thank you again, Beth, for your work.
Thank you, Beth. Thanks very much for joining us. Take care.
You too.
Right, so we've got a few more papers to conclude. Paper V, which is progress on the Nhft people plan. Can we take the report as read, Chris, in the interest of time? But I think you do want to come back to us, don't you, with an update on further progress. So I'll let you come in on that.
Yeah, if you want me to, I mean, I could go through highlights, but given time, Krishni, I'm happy to say that obviously you've got the key areas of focus. I think we all experience that the looking after our people, belonging in the NHS and growing for the future kind of do leap out as priorities. I'd also say that this is, I think it's hard to describe it. It's a bit of a moving feast in that nationally the Chief People Officer has stepped down. We've got an interim Chief People Officer. They've also produced some further iterations in the work on the future of HR and OD. So the clarity maybe of what the goals and targets are is a kind of a developing piece, I would say. But against that background, I'd want to note that I think we've made substantial progress, and particularly as the HR team during this have done all of the work on VCOD during the sort of 3 months around the winter. So I think we have been able to move it on substantially during that period. And obviously there's a lot of detail of the work we've done. Just to pick a couple of highlights, we've talked about the workforce planning and the workforce and getting down to 6.9% vacancy, and the recruitment has been huge. Also, Say No to Racist Patients has been a real challenge, and that's now launched and moving forward. So huge things there, and the understanding racism and our move towards inclusive leaders. I think because of the priority of workforce, what I would suggest is this is a 6-monthly update, but I think we should be looking to refresh it because of the moving environment. I think rather than maybe doing a 6-monthly report, it would be wise to come to every other board to update on what we're looking to do. And I'd hopefully recommend it to the board for assurance that we're progressing the work, and to support the idea of coming back every other board and refreshing the plan as we move forward. Okay. And I'd just like to voice my thanks to the HR team, because as I say, I think they've worked extremely hard, as a number of people have already said, to deliver what is a challenging agenda, working with colleagues, particularly in Ops and Corporate, Jean's team.
Thanks, Chris. Okay, I've got a couple of comments. Melanie and then Judith.
Yeah, thanks, Chris. A phenomenal amount of progress and a huge plan, which is probably where just 2 comments really. The first one is, and I'd welcome, you know, sort of the regular updates that you intend to bring. I think it would be helpful to get a flavour in this plan of the phasing of the delivery, because you're not doing it all at once. And therefore, to get the whole plan, we won't always see progress on everything. So I wondered whether it might be useful to try and introduce some phasing so that we could just focus the update to the board on the areas that you expected to make progress on, if that makes sense, or something that actually just condenses the amount of work the HR team have to do in every update to something that's very focused on where we're focusing.
You'll be pleased to know, Melanie, as I was doing the update, I did think of you and I thought, I'm sure Melanie will challenge me about phasing and how do we plan that moving forward. And hence that's partly why I've suggested we refresh it and then we start to, we're getting more of a clearer picture. So let's see if we can start to hone it down to when do we need to deliver certain points and then push ourselves to do that. So
yeah, and I don't think, this isn't about setting deadlines. It's just about understanding how we're planning to address all of the different aspects. And the only other comment I had is just some of the things that didn't come through as strongly in the plan was how we're evaluating some of the initiatives that we're taking forward and how do we know that they're having the impact. And we talk about this a lot in the wellbeing area, of course. So when you do something, how do we know that it's actually, hitting the mark? So I think it would be interesting just to try and draw that out maybe in what we're doing, or if necessary, sort of make sure that there's that focus on understanding impact as well as just understanding the delivery.
Yeah, and we are I'll just say we are doing more of that. So for the understanding racism, and it's in the risk register, I think we did a review of that and got feedback from those through it and then built onto that. So I think we've got examples and we need to build more of those as we move forward. I'd agree.
Yeah, thank you.
Thanks. Judith next and then Trudy.
Thanks, Krishni. I'll be very quick because Melanie covered my first question, which was about the deliverables and the bottlenecks. If you're delivering all of this in the next 6 months, where do you feel the bottlenecks are? But if this is a staged delivery over the next 6 months, then I'll hold off on that. And my second question, both Scott and Melanie have already covered it. It was about the measurables. How do we measure that we have achieved success? So thanks for that. That was quick.
Thanks, Judith. Trudy? You're on mute, Trudy.
I just wanted to mention we did have a celebration last Friday because it was International HR Day. So we took the opportunity to get everybody online, and Chris, Jean and Dave came to say thank you to the staff for all the hard work that they've undertaken over the last year, especially throughout the the difficult time in VCOD. So I just wanted to note that, really.
Yeah, thank you, Trudy. I think that's really important, isn't it? Because we, throughout this whole pandemic, actually, the people function actually has had to step up to do all sorts of things at pace and along with everybody else. But we do need to recognise that created additional pressures that perhaps didn't exist before. So it's really important that recognition was given. I think a general comment that I would make, I'm supportive, as I think others are, receiving regular updates. What I'm just slightly nervous about is we have an annual plan and people should be part of our annual plan. And I'm a little bit kind of nervous that we've going to have 2 updates on separate things, which really ought to be integrated. So just a question around really, how do we make sure that we're making progress around, the people agenda as part of the annual plan, and how does that fit with the people plan? That sort of because people is so much fundamental to everything we do. We talk about it, probably have talked about people all the way through the agenda. So what I wouldn't want to do is sort of repeat things just because we've got an update, because we've actually covered it in almost everything else. So just a thought about how we make sure it feels integrated, Chris.
Yeah, we have. I mean, I think the people plan is in the operational plan and we've drawn those elements out. So I think in liaison with David, we can weave those in to make sure that we're not reporting, or if reporting on the people plan, it is almost us updating on the grow section of the DIGBQ strategy, which in the beginning of the paper we have highlighted that the 2 are interwoven. So maybe that's the answer, that we bring back in effect what is an update on our people plan and the grow element of the DIGBQ strategy, which may need more time than others because, as you say, it's our biggest risk and we need to put more of a focus on it.
That would be great if we could just ask you to think about how we join that picture up. I think that'd be really helpful because it's such a key enabler, as was described in the annual plan. So if we can leave you to think about that, but otherwise really helpful. And thank you for the update. And I think we have to recognise that it's that there is a little bit of uncertainty nationally, isn't there? But it doesn't stop us from making progress ourselves on the areas we know are important. Okay, we have a couple of other items to conclude. So provider license compliance. Chris, are you happy to cover this as well? I think these are both your papers, aren't you? So do you want to say anything about this?
Yeah, so the provider license, we've been through that, Fiona, myself, Director of Corporate Governance, myself, to review all of that, and Richard on the resources element. So if the board is happy, we would just recommend it for approval.
Yeah, and just to colleagues who are at the Council of Governors will recall that this was presented to the Council of Governors and reported that that we would be bringing it here. I think Fiona was clear at the time that we no longer need to actually formally do this, but we thought it was good practice. I did just want to reflect into the meeting that I did have some feedback after the Council of Governors, which I agreed to just reflect in, not to do anything other, not to change the decision required, but just to reflect that clearly one of the frustrations I think we recognise that the Council of Governors has had is their ability to fulfil, or their sense of their ability to fulfil, particularly the representation function, which has been constrained by the pandemic. So it was just really a point about making sure we pick that up as part of the joint workshop we've got coming up, which Richard and I have already discussed, and I know we're sort of on the case to do that, but I wanted to reflect that in because I was governor colleagues asked me to do that. So but the decision of the board is to consider the self-certifications and endorse the position presented. So on that, happy to do that. Okay, thank you. And then the board development programme, Chris?
Yeah, again, I think we'll take as read. We've identified the core topics which are shared in the paper, and then really we've set out how we're looking to pick those up. As you know, Krishni, that's been worked through with yourself, Fiona, Richards, and I think an important development is we're now starting to flag where we think the development links to the well-led Chloe is. And I think for all of us thinking that what we're trying to do is develop the board against that well-led framework is a good focus for us to have.
Yes, I think that was something we discussed, didn't we, as one of our in one of our board development sessions. So I think that's really helpful. Angela?
Yeah, just to say, so I'm also conscious we did some board development or OD sessions as part of the East Midlands Alliance, and I just wonder whether we ought to reflect the group and how we're going to do that development as well. So it's just something to take away, Chris, to sort of just weave in those wider partnership elements that we're clearly participating in as well.
Yeah.
Yeah, well, obviously, Angela, we do have the joint workshop with LPT on Together Against Racism as part of the board thing already, so be building on that.
Yeah,
it's potentially, if there's any others that we want to at least capture, I think that it's been done, because actually we've got board development happening in lots of different places, but it's with some members, not all, so it's just useful to acknowledge that, I think. But overall, any comments, or is everyone broadly content? Is there anything that colleagues feel is perhaps they'd like to see added? Was everyone happy that it reflects the kind of areas we should be looking at together? And you can see the team building element sort of built into it, which I said earlier I felt was important. You did?
Just a quick question. I hear that there's going to be a new code of conduct in relation to non-executive directors, and I was just wondering how that would fit into the board development.
It's not so much, I don't think it's a new code of conduct, it's a new code of governance, right, for all organisations. It's going to be published, well, consulted on apparently, and then published in readiness for the 1st of July. So obviously once we've got it and we understand the differences, then I think we can build that in, but absolutely we'll need to understand what it highlights and what it reflects. I think it's predominantly about sort of setting the new context in relation to the ICB. So probably, you know, a part of this will need to be, in fact, I think it's probably picked up on the 6th of October one, strategic context, system leadership. I suspect those sorts of areas will pick that up, but we'll absolutely reflect on that, Judith.
Thank you.
Okay, thank you very much. The remaining items there are for information. Can I just check whether anyone's got any items they want to pick up as part of that? So we've got quality regulatory inspections update, which does go through quality and safety, I believe. That's in items for information. Don't know whether you wanted to highlight that at all.
I don't think it doesn't go through quality and safety. It just comes here now because we've only got the 2 outstanding must-dos.
Okay.
I don't remember it going to quality and safety.
Okay.
There's nothing to highlight in there. It's just an update, and we've just added in the Crystal programme because obviously that's a new programme that's in place instead of outstanding for all. So it's our governance. So that was all. Thank you, Chair.
Yeah. Thanks, Julie. I just didn't want us to overlook it if there was anything to note. So it's obviously there for our information and helpful to have the update. And we've got a couple of others as well. But if there are any questions or comments, there's a medical education development postgraduate and undergraduate. I don't want to not do these things justice, but we are somewhat over time and we have private board obviously to fit in as well. So just wanted to make sure that people had picked up on these and recognised the good work that was in them. Is that okay? So any other business before we close? Okay, and in terms of snapshot review, as ever, I think challenging to try and fit these in these sort of board meetings with slightly developing agendas, which, you know, are of a more strategic nature to fit into these 2-hour slots. So I think we'll all be grateful to go back to a semblance of normality in terms of having a little bit more time to cover these things. Otherwise, we do sometimes feel like we're up against it. So I think we'll all be grateful for that. Any other feedback or comments regarding the meeting before we close? I know we've said we'll need to look at the reports and SPC charts and feeding some of that in, but I think that's a general point. Okay, well, on that note, I'll close the meeting. I think we probably do need a little bit of a break. The private meeting is due to start at 12, but I suggest we start at 12:15. Would that be okay with everybody? Might mean we have to run on to well, I think it's due to run on till 1:15 anyway, but I'm just conscious that we'll try and pull that a little bit back from the private meeting, if that's all right. So 12:15 to give everyone a bit of a break, and we'll see you in the private meeting. Thank you everybody for your contributions, and thanks for people observing.
Thanks, Christian.
Take care, everyone. Bye bye.